Welcome to our channel. Today, we're discussing a critical health issue, the Marburg virus disease outbreak in Rwanda. This rare but severe hemorrhagic fever has the potential to become a global health emergency if not contained. We'll delve into the details of this virus, exploring its origins, symptoms, transmission, and the ongoing situation in Rwanda. Understanding the facts about Marburg is crucial to protect ourselves and our loved ones. We'll discuss the virus's high fatality rate, the importance of early detection and treatment, and the measures being taken to control the outbreak. Knowledge is power, and by staying informed, we can help prevent the spread of misinformation and contribute to a swift and effective response to this emerging health threat. The Marburg virus, named after the German city where it was first identified, has a history dating back to 1967. Simultaneous outbreaks in Marburg and Frankfurt, Germany and Belgrade, Serbia, brought this deadly virus to the world's attention. These initial outbreaks were linked to laboratory work involving African green monkeys imported from Uganda. This highlighted the virus's presence in animal populations and its potential to jump to humans. Understanding the origins of Marburg is crucial for developing effective prevention and control strategies. By studying the virus's natural reservoir and transmission patterns, researchers can better anticipate and mitigate future outbreaks. One of the most alarming aspects of the Marburg virus disease is its high fatality rate. This deadly virus attacks multiple organ systems, leading to severe internal bleeding and organ failure. The fatality rate can vary depending on the outbreak and access to healthcare, but it has been as high as 88% in some instances. This underscores the critical need for early detection, prompt treatment, and effective containment measures. While a high fatality rate is undoubtedly concerning, it's important to remember that survival is possible, especially with early supportive care. Knowing the symptoms of Marburg virus disease is crucial for early detection and treatment. The disease often begins abruptly, with symptoms such as high fever, severe headache, and muscle aches, mimicking other common illnesses. As the disease progresses, more severe symptoms may develop, including diarrhea, vomiting, abdominal pain, and unexplained bleeding or bruising. These symptoms often appear between 2 and 21 days after exposure to the virus. If you experience any of these symptoms, especially if you've recently traveled to an affected area or had contact with someone who might be infected, it's essential to seek immediate medical attention. Chapter 4. How it spreads. Understanding Marburg transmission. The Marburg virus spreads through direct contact with the bodily fluids of infected people or animals. This includes blood, saliva, vomit, urine, and feces. Transmission can occur through direct contact with these fluids or contaminated surfaces. For example, caring for an infected individual without proper protective equipment or handling contaminated bedding or medical supplies can lead to infection. Additionally, exposure to infected animals such as bats or primates poses a significant risk. Understanding how Marburg spreads is crucial for implementing effective infection control measures, both in healthcare settings and the community. Chapter 5. Rwanda's battle, the recent Marburg outbreak. In September 2024, Rwanda reported its first ever Marburg virus outbreak, raising global concern. With 36 confirmed cases and 11 deaths, this outbreak highlights the virus's potential to emerge in new regions. The outbreak has strained Rwanda's healthcare system, prompting a swift response from local authorities and international organizations. Contact tracing, isolation of suspected cases, and public health education campaigns are underway to control the spread. The situation in Rwanda serves as a stark reminder of the importance of global health security and the need for coordinated efforts to combat infectious disease threats. Chapter 6. A global threat, Marburg's potential impact. The Marburg virus outbreak in Rwanda has sent ripples of concern across the globe. The interconnected nature of our world means that an outbreak in one location can quickly escalate into an international health emergency. 2 individuals in Germany, including a medical student who had contact with an infected patient in Rwanda, were tested for Marburg. While both tests came back negative, this incident highlighted the potential for the virus to spread through travel. The global community must remain vigilant and prepared to respond to the threat of Marburg. This includes strengthening surveillance systems, enhancing laboratory capacity, and ensuring access to effective treatments and vaccines. Chapter 7. Mapping the spread countries affected by Marburg. While the current outbreak is centered in Rwanda, Marburg virus disease is not new to the African continent. Several countries have grappled with outbreaks in the past, highlighting the virus's persistent presence in certain regions. Angola, the Democratic Republic of Congo, Ghana, Kenya, South Africa, and Uganda have all reported cases of Marburg. These outbreaks often occur in remote areas with limited healthcare infrastructure, making containment challenging. Understanding the geographical distribution of Marburg is crucial for directing resources, strengthening surveillance, and implementing targeted prevention strategies in high-risk areas. Chapter 8. Fighting back response measures and precautions. The Marburg virus outbreak in Rwanda and the potential for international spread have prompted swift action from health authorities worldwide. German authorities, for example, temporarily closed part of Hamburg's central train station as a precautionary measure following the suspected cases. This proactive approach highlights the importance of early intervention and the need for coordinated efforts to prevent a larger outbreak. In addition to government actions, individuals can also play a role in preventing the spread of Marburg. Practicing good hygiene, such as frequent hand washing and avoiding contact with bodily fluids, is crucial. Outro: stay informed, stay safe. Thank you for watching. The Marburg virus outbreak in Rwanda is a serious public health concern, but by staying informed and taking necessary precautions, we can help limit its spread. Remember, knowledge is power, and understanding the facts about this virus is the first step towards protection. Stay informed about the latest developments from reliable sources, such as the World Health Organization and local health authorities. Follow their recommendations for prevention and seek immediate medical attention if you experience any symptoms. Don't forget to like, share, and subscribe for more updates on global health issues. Together, we can create a healthier and safer world.